The professional that I interviewed, his name was Spencer. He is a mental health screener slash technician at Johnson Health Center. He has a bachelor's in psychology and he is licensed as a qualified mental health professional, A and C. He graduated from the University of Tennessee, and then he was qualified before the new qualifications came. So he has an adult and a child, but he said that they're combined now, but he can do both adults and pediatrics. His job duties include providing initial behavioral health interviews. So if there's a patient in the office that needs like just a screening, he goes into the room with them, he talks with them about their problems, what they want to and any options that they want to do. So like if they want to do counseling, he'll direct them to a counselor. If they want medications, then he directs them to a doctor. And then there are some times where he says that there are situations or cases that are too complex for the providers in office. So he also makes referrals to like UVA or Horizon or anywhere else that the patient may need to go. He does not prescribe medication and he does not personally do any counseling sessions. So he's kind of just like a go-between. Like he just like pushes the people to where they need to go before they see who they're supposed to see. What he found most fulfilling about his position is helping people and, you know, meeting them where they are, kind of initiating their care and making sure that they get to where they need to get to. He said that he's worked in a couple of different positions, including like substance abuse. And although he did like the substance abuse work, there were some times where he felt like it was a little overwhelming. So he does like this scope that he has now to where it's not as much pressure to like treat and take care of people, but he still has the ability to refer and get people what they need. The most challenging thing that he said about his position is also helping people, because a lot of times you have people who come for their initial visits. They do the initial screenings like on paperwork, but then they don't want to like translate that to actual therapies or actual like treatments. So it's kind of hard to like let them know that they need help and kind of directing them to the kind of help that they need. Because a lot of people either say they want help and then like they kind of fall off for whatever reason, and then you kind of have to reel them back in, or they just don't want what you have to offer, and they just fall off that way because they're not satisfied with the services that they give, that you have to offer them. What he does to continue his growth in the field, he says that sometimes he will attend like seminars. He keeps up with his CEs through Johnson Health Center. They do have like mandated CEs for the job, so he gets a lot of credits from that. And then just keeping up with like the latest research about medications, about referrals, about different mental illnesses, especially with children. There are a lot of like changing medications, changing diagnosis with children, so it's easy to kind of fall behind in that. So he said that that's a way to that's a really good place to like start with like continuing growth in the field. Recommendations for a new grad. His most important recommendation was to kind of explore. Don't get your heart too set on one thing that you think you might want to do after graduation. He said that it was good to have goals, it's good to have like a mindset, but kind of explore, because a lot of times when you first graduate, you have an idea in your head, but then you can get into the field and realize that that's really not what you want to do, or you could just find something that's more prevalent in your area, or something that is more rewarding, or something that fits into your schedule more. Like when he was talking about his personal experience, when he first started going to school, he wanted to be a veterinarian, but then he changed when he first came to his current position, he was doing substance abuse, which, like I said, he really enjoyed that position. But then they kind of realized that they did not have the appropriate like procedures and stuff for that work, so he kind of had to change his scope again. So he said to just be willing and open to change. Don't be so set in your ways, but also set goals, if that makes sense. So yeah, that's it.